Good day everyone. Today we will learn about genetic assessment and genetic counseling, and we will also tackle about the common chromosomal disorders. When we say genetics, it is a branch of biology that is concerned with the study of genes, genetic variations, and heredity in living organisms. And when we say genetic counseling, this is the process of communicating information to clients regarding how are you going to solve or to manage that identified problem, and also in there, they are giving advices also on the affected individual or families, or for those who are somewhat at risk of having genetic disorders. And also during genetic counseling, they are informed about the condition wherein they also try to explain the condition in a way the client or family to understand, to accept, to adopt some medical or psychological interventions, and also to help them plan what are they going to do just in case they have or they do have or they will have a member who has genetic disorder. We also have other terms just like phenotype. So this refers to the outward appearance of the expression of genes. We also have genotype. This is the actual composition. The genome is the complete set of genes, and the normal genome is 46XX or 46XY. We also have the term genetic disorder. So this means that this condition could be passed from one generation to the other. And we have some reasons why families or individuals are somewhat high risk of this. So one is because they belong to same ethnic group. Other reason is because of the division of the fertilized egg cell, like there is something happened during the cell division that leads to genetic disorder. So in order to assess the client has the genetic disorder, they need to undergo assessment. So in this assessment, we have three ways. First, we have history taking. Second, we have the physical assessment. Then next is diagnostic test. So for history taking, the doctor will be conducting interviews to the affected family or individual, and they're also advised to call the other members of the family to be with them during the interview and assessment. Part of history taking is the asking of the age of the mother as well as the age of the father. And they say if the mother's age is more than 35 years old and the father's age is more than 55, they say that there are some risks or high risk to have a child with genetic disorder. Also part of this history taking, they will also try to ask if the couple is related by blood or what we term as consanguineous. Because they say that if they are somewhat related by blood, the incidence of the genetic disorder is somewhat high. And again, you will also be asked if they belong with same ethnic background. If the female client will say that her previous pregnancy or having a child with abnormality, the doctors will try to do an extensive prenatal history. So what causes that firstborn child to have genetic disorder? So they will try to ask the lifestyle of the mother, also try to ask if she has taken medications for the first trimester, and the doctor will also be asking if they have a relative who has this genetic disorder. So aside from history taking as part of the assessment, physical assessment will also be done. While the doctor is conducting the interview, the doctor is already assessing the patient while talking with them. So the doctor might try to observe the space between the eyes, shape of the eyes, shape of the ears, the location of the ears, the numbers of fingers and toes, height, and other physical characteristics. They will also try to check the skin for skin markings or surface markings of the skin, and it is termed as dermatoglyphics. What should be normal, especially in the palm, there should be more creases or lines. Another part of assessing is the use of laboratory tests or diagnostic tests.
Karyotyping is a sample of peripheral venous blood or scraping of cells from the buccal membrane is taken. Cells are allowed to grow until they reach metaphase, which is most easily observed phase. Cells are stained, placed under a microscope, and photographed. Chromosomes are identified according to size, shape, and stain. For the maternal serum screening, this is done at the 15th week of pregnancy. There's also alpha-fetoprotein or the AFP. This is a glucoprotein produced by the fetal liver. The peak is between 13th and 32nd week of pregnancy. For the result, if elevated, it means spinal cord disease or neural tube defects. If below, it means chromosomal disorder, Down syndrome, or the MSAFP or maternal serum alpha-fetoprotein. The CVS or the chorionic villi sampling. It is a diagnostic technique that involve the retrieval and analysis of chorionic villi from the growing placenta for chromosome or DNA analysis commonly done at 8 to 10 weeks or 10 to 12 weeks of pregnancy. This may also be done as early as 5 weeks.
Now, I will talk about amniocentesis. In here, they will be extracting amniotic fluid in client's abdominal wall, but before that, the doctor needs to locate the baby so that they will be guided where to insert the needle. So, ultrasound first before inserting needle. And of course, in inserting the needle, the doctor needs to clean the area using betadine, and they will be using a long needle just like a spinal needle and aspirate 15 to 20 ml of amniotic fluid. In the insertion of needle, the baby should not be pricked, that's why ultrasound is essential at bedside. The aspirated amniotic fluid will be used to determine abnormalities and disorders, and after that, the doctor will be giving RH immunoglobulin or ROGAM to prevent RH sensitization. The next one is PUBS, or percutaneous umbilical blood sampling. It is also called cordocentesis. This is the aspiration of blood from the umbilical cord, and usually, they are doing this together with amniocentesis. This is also used to determine abnormalities, and it is being done at 17 weeks. The last one is fetal imaging. We have MRI and ultrasound. So this is used to assess size of the fetus, and they can also determine if the baby has a structure disorder as well as problem pertaining to internal organs, the spine and limbs.
Now let's discuss the common chromosomal disorders.
Down syndrome is a genetic disorder caused by the presence of extra chromosome 21. It is typically results in intellectual disabilities, distinctive facial features, and various health issues, but the severity can vary widely among individuals. Genetic disorder that occurs when there is an extra copy of chromosomes 21. This extra genetic material disrupts typically development, leading to a range of physical and cognitive challenges. Individuals with Down syndrome often have characteristic facial features such as almond-shaped eyes, a flattened facial profile, a protruding tongue, and they may also experience intellectual disabilities, delays in speech and motor skills development, and have an increased risk for certain health conditions including heart defects, thyroid disorders, and leukemia. Low muscle tone. Many individuals with Down syndrome have decreased muscle tone, which can affect their ability to sit and stand and walk independently. Behavioral and emotional challenges. Some individuals with Down syndrome may experience behavioral and emotional challenges such as attention deficit, hyperactivity disorders, ADHD, anxiety, and depression. It is important to note that while these features are commonly associated with Down syndrome, each individual is unique and the severity of symptoms can vary widely. Early intervention, supportive therapies, and access to medical care can help individuals with Down syndrome thrive and reach their full potential. Fragile X syndrome is a genetic disorder characterized by intellectual disabilities and behavioral challenges. It is caused by mutation in the FMR1 gene, which can lead to deficiency of protein necessary for development and function. Fragile X syndrome is the most common inherited cause of intellectual disabilities. Individuals with Fragile X often have learning difficulties, cognitive delays ranging from mild to severe. People with Fragile X syndrome may exhibit behaviors such as anxiety, hyperactivity, impulsivity, and difficulties, and repetitive movements. Physical features, while less pronounced than in some other syndromes, individuals with Fragile X syndrome may have certain physical features, including a long face, large ears, and a prominent jaw. Speech and language delays are common in individuals. They may have difficulty with expressive language, social communication, and understanding abstract concepts. Early intervention, supportive therapies, and specialized education programs can help individuals with Fragile X syndrome manage their symptoms and improve their quality of life. Trisomy 18 syndrome, also known as Edwards syndrome, is a genetic disorder caused by the presence of an extra chromosome 18. This extra genetic material disrupts typical development and leads to a range of physical and developmental abnormalities. Trisomy 18 is typically associated with severe intellectual disabilities and multiple congenital anomalies. Intellectual disabilities. Individuals with trisomy 18 often have severe intellectual disability, leading to developmental delays and challenges in acquiring skills such as walking, talking, and self-care. Trisomy 18 is characterized by a distinct set of physical features, including low birth weight, small head size, clenched fists with overlapping fingers, rocker bottom feet, prominent occiput, and small jaw. Other common features may include a cleft palate, heart defects, and kidney abnormalities. Trisomy 18 can affect the development of various organs, leading to structural abnormalities such as heart defects, kidney malformations, gastrointestinal issues, and abnormalities of the central nervus. Individuals with trisomy 18 typically experience growth retardation both before and after birth, resulting in low birth weight, slow growth, and failure to thrive. Trisomy 18 is associated with high rates of mortality, with many affected individuals dying before or shortly after birth. However, with advances in medical care and support interventions, some individuals with trisomy 18 may survive into childhood and adolescence, albeit with significant medical challenges. Trisomy 18 syndrome is a complex condition that requires comprehensive medical care and supportive interventions to address the multiple physical and developmental challenges faced by affected individuals.
So next is I'll be going to discuss Turner syndrome, code 45X0. It is a genetic disorder that affects only females. It occurs when a female is partially or completely missing an X chromosome. Most people have two sex chromosomes, XX or XY, but in Turner syndrome, there is a deficiency of one X chromosome. And for clinical manifestation, low set hairline, web neck, short in structure, exception of pubic hair, secondary sex characteristics do not develop at puberty, and for newborns, edema on the hands and feet with coarctation of aorta and kidney disorder, and severely cognitive challenge. Next is the Klinefelter syndrome with code 47XXY. Klinefelter syndrome is a chromosomal disorder that affects males. Typically, males have one X and one Y chromosome, but individuals with Klinefelter syndrome have at least one extra X chromosome, resulting in a genotype of XXY or variants like XXYY, XXXY, or etc. This additional X chromosome usually comes from the mother's egg. And for clinical manifestation, absence of secondary sex characteristics, small testes produces ineffective sperm, and large breast size, increase of risk of male breast cancer. And for trisomy 13 or Patau syndrome, with code 47XXY3, trisomy 13, also known as Patau syndrome, is a chromosomal disorder caused by the presence of an extra chromosome 13 in some or all of the body cells. This additional chromosome disrupts normal development, leading to a wide range of physical and intellectual disabilities. Patau syndrome is characterized by multiple congenital anomalies and is associated with severe intellectual disability and life-threatening medical problems. Here are some of the clinical manifestations and features commonly seen in individuals with trisomy 13 or Patau syndrome. Microcephaly, clipped lip and pallid, low set ears, multiple hair walls, wide set nipples, rocker bottom feet, heart defects, abnormal genitalia, and small eyes.
So we're done now with the assessment and diagnosis. What is next is the doctor now will try to analyze the result of the diagnostic or lab tests. So after analyzing, the doctor will now be referring to this concerned professional. So in here, if the concern is more on the genes problem, they will go to the genetic counselor. So we have the genetic counseling. It's time for the doctor to inform the client about the result. The data or the information that will be given to the patient should be concrete. It should be accurate or it should be correct. Concrete in the sense that there is the presence of evidence such as the diagnostic test result and the assessment. The genetic counselor will now be communicating to the concerned family. The doctor will try to reassure that if ever they have a child or they have a child who has this genetic disorder, there is a tendency to have another child who do have the same problem. Clients are allowed to make their decision if ever the first have problem way and the second child has it again. The doctor will now be asking them what will be the plan. Do they still need to add another, or are they still okay if they have another abnormal child or a special child that have same condition? So what will be the nurse's role? During genetic counseling, it is the doctor who will try to inform the diagnosis or the condition of the patient. So just like here, guiding women or couple through the prenatal diagnosis, so you're guiding them undergo prenatal checkup. The importance of prenatal checkup is we can determine if she has a condition or complications. Another role of nurse in genetic counseling is helping parents to make decision in regards to abnormal prenatal diagnosis results. So after the clients have learned that they have abnormal result, so you need to wait for the couple to ask for help from you. So that's the time you need to explain in a way that the client will understand. So another is assisting parents who have had a child with a birth defect to locate needed service and support, assist them who they need. It's like referring or coordinating to other services of healthcare professionals. You will be giving them list and you can tell them this specialty and let the couple choose. And of course, you need to provide emotional and psychological support, which is the important role of nurse throughout the genetic counseling. Thank you for listening. That's all for our report. We hope you learned something.